Okay, this video is low-fat vegan diet worth it? Because I'll have times, I'll go to a social event, and there'll usually be some fat person, they mean well, and they're like, well, don't you want to enjoy life? Don't you want a piece of pizza, or don't you want some fried junk food or something? I'm like, no. You know, I don't, I like the taste of the low-fat vegan diet, but I know the problems that all that other food causes. This is a picture of me in my 30s doing imaging-guided surgery. And I was getting fat at that point. Had a wife at home had a kid at home with the wife, the ex-wife, and I got real fat. I got up to 220 pounds, which is real heavy for me. I'm only 5'9", you know. So it was not good. I tried on my own for a couple years to lose the weight, and I lost a lot of it. I was eating sort of a Mediterranean diet, and then I learned about Dr. McDougall, Starch Solution, and all that, and I lost all the rest of the weight, and I dropped from, you know, about 220 pounds down to about 154 pounds. Okay, and I moved to a house where I could exercise more, had a pool in the backyard and everything, and that's what I looked like after that. And so I'll just show you another picture too, just so you know I've been there. You know, now I'm in my mid-60s. You know, here I'm having a lot of fun. I learned that from my mother too. When my mother was in her 60s, man, she was so happy. Her life was so joyful. I'm like, wow, life can be a lot of fun when you're in your 60s. I'm having a lot of fun. I like making my videos, my YouTube videos. You know, I come home from work and it's shit, shave, shower, showtime. I crank out a couple videos. I like writing my books. This is about half of the books I've written. And, you know, even though I know I'm shadow banned and ostracized, as far as I can tell, I'm the best medical writer in the whole world. I don't even see any competition. If there's anybody you think is as good a writer as me, look a little more carefully at their books, how much bullshit is in there, their style of writing, and I think you'll see that what I'm saying is true. Okay, you know, I got this gorgeous young wife. I'm enjoying that. So let me just give you a little bit of perspective here. You know, like Walter Kempner had said, get your pleasure from other things than food. Don't get me wrong, I enjoy the food, but I enjoy being healthy so much more. When I was eating the Mediterranean diet, I was fat and I was on my way to becoming ugly. My whole family was mocking me and teasing me. My ex-wife said, oh, well, you know, keep that up. You'll be impotent soon. That'll make my life easier. You know, and my family members were all making fat jokes at me all the time. Fat person is very high risk for hypertension, diabetes, coronary artery disease, abdominal pressure syndrome. I had back pain, lower extremity neuropathy, all that stuff, back pain, lower extremity neuropathy, it all went away. A little bit of irritable bowel syndrome, it all went away when I went low-fat vegan. The guys my age, most of them are overweight, fatty liver, prediabetes, diabetes. Often they've gone for back pains. A lot of my medical doctor buddies have. A lot of them have hypertension. Even the guys who are AOAs, top percent of the medical school classes, because they don't know nutrition. If you don't know nutrition, you're kind of helpless. And they're fat, hypertensive, diabetic. I got some female doctors that are fat and sick, and they won't even talk to me. They're like, I'm like offensive to them because I'm still skinny and stuff. Guys my age routinely, they're going for stents, open heart surgery, prostate cancer surgery and procedures, abdominal pressure syndrome. I'm skinny, you know. For an old man, I look good. You know, I ain't a young guy anymore, but I don't have to take any pills. I've never had to have a surgery. I got good energy. I can run up and down 50 flights of stairs pretty easy. I can walk 7-8 miles easy. You know, my strength is pretty good for an old guy. I don't have any caffeine. So what I'm trying to say is, of course it's freaking worth it. There is no medical surgical bullshitology that can prevent these diseases. The pills don't work, okay? There is no other diet that's any good. The Mediterranean diet's a fake. It's a joke. And all this stuff about paleo, keto, carnivore, Mediterranean diet, it's all nonsense, okay? They just have to keep the pros confused so they can keep them sick. All right, all you got to do is look at epidemiology, and it's easy. 1 billion out of 1 billion rice eaters, they're all freaking skinny because 1% of calories from fat. The sweet potato eaters are skinny because 1% of calories from fat. The lower the percentage of calories from fat, the skinnier the population. Papua New Guinea sweet potatoes, those African populations like Kenya and stuff and other ones. The regular potato eaters, also 1% of calories from fat. They're skinny. Lentil beans, 3% of calories from fat. Black beans, 4% of calories from fat. When you're eating stuff like that, you're going to be skinny. And a lot of the other grains are not so bad. You know, oatmeal is about 15% fat. That's about as high as you should go on fat. But, you know, you look at fish, it's like salmon, typical, 50% protein, 50% fat. That's terrible. Okay, fish is for chumps. All this stuff is for chumps. All this Mediterranean diet, high-fat nonsense, nuts, seeds, olive oil, omega-6 oils, that's all nonsense. Avocados, that's all BS. Dr. McDougall said it quite clearly. The biggest toxin in the Western diet is the fat. Nathan Pritikin said it very clearly. Fat is bad. When you get that through your head, as Dr. McDougall had said, unless you've read Kempner and Pritikin, don't even talk to me. You're too ignorant to waste my time. Because a lot of people, they ask me the same questions over and over again. I'm like, just hit the search button on my YouTube channel. There's a little magnifying glass. Hit the search button. If you're interested in protein, watch that. If you're interested in weightlifting, pre-workout meal, hit that button. You will see I've got thousands, like 5,000 videos. But anyways, what I'm trying to tell you is, thank God for the low-fat vegan diet. It's the only way. I've been a doctor 35 years. I've studied this backwards and forward. Fellowship at Harvard with the emphasis on vascular disease. I've written numerous. I'm the world expert on preventing dementia, vascular disease, back pain. And I can tell you, there is no other way to prevent these diseases than eat a low-fat, plant-based diet. You might get away with being 90% vegan, but it's hard to be 90% vegan. It's easier to be 100% vegan. But anyways, yeah, it's the best thing in all of health. It's the most powerful thing. There's other things that are good to know. Filter your water, eat only organic, all that stuff, single ingredient foods only. I'm not scared of disease. Big pharma might kill me. Big food might kill me. But I'm not afraid of these diseases. Anyways, I hope you found this helpful.